Hi, I'm Julie Graham. I'm a student physical therapist assistant at Jeff State, and today I want to discuss with you my initial treatment plan for my patient. My patient is a 19-year-old female who has had a ACL repair. She's had a patellar tendon bone autograft done. At the time of the initial treatment, she had just had it 3 days prior to that. She injured her leg a week before that playing intercollegiate basketball, and her ultimate goal is to get back to playing intercollegiate basketball. Now at this point, the doctor wanted her to be partial weight bearing, 50% in ambulation until 7 days past the surgery. So now we're at the initial treatment that they want now her to progress to weight bearing as tolerated from the 50% partial weight bearing. One of the things too, she only has range of motion is very, very limited. It only goes from 15 to 80 degrees. She also has quite a bit of edema and swelling in that area. It has a warm and boggy feel to it. There is also decreased patellar movement in that area. A lot of it probably due to the swelling. She also has weakness in quadriceps. There's very weak isometric contraction in her vastus medialis oblique. One of her short-term goals is to increase her flexion and extension by 10 degrees, and also to have weight bearing as tolerated without crutches. And today she's supposed to progress to the weight bearing as tolerated. Also the circumference right above the patella and below the patella is 2.5 centimeters greater than the left. So once again, there's quite a bit of swelling in there. So one of the first things we do to address some of the swelling and edema in the leg is use compression, elevation, and ice. Probably one of the game day machines would probably be one of the best ways to do all of those things together. And then once we've got some of the swelling down, that would probably do a lot to address some of the range of motion and the pain that's in that leg. The next thing we would do would be to do some joint mobilizations. And actually would do some patellar joint mobilization. So is it all right if I pull your pant up here?
Yes.
Okay, and what I'm going to do is I'm going to slightly move this bone in here around. And I know it seems like it just floats in there, but actually it's in a tendon. And so what you want to do is you want to get some movement in this area and start to get, you don't want any adhesions to start. You also want to, where the scar is, you want to kind of massage that scar whenever you're just sitting around watching TV or anything, because that's going to help keep from any adhesions starting underneath there where you've had that surgery. So you want to kind of break up that material, the tissue a little bit, so that you'll get more movement in that knee. Okay? All right, so first thing I'm going to do is I'm just going to take like the web of my hand here, up above your kneecap, and then I'm just going to slightly push it in that direction. There's not going to be a whole lot of movement, but just enough to start to get some movement from your kneecap back in there, okay? All right. And probably we're going to go back and forth, from the top we'll start, okay? And then we'll go do some from the bottom. Okay, and then each side. So it doesn't need a lot of movement. Okay. And we do that probably for about 10 minutes, really, going from each area just to really kind of try to break that tissue up. Okay?
10 minutes each?
Not 10 minutes each, 10 minutes altogether.
Okay.
Yeah, just try to get as much movement as possible in there. Okay? All right, so then the next thing we would do is I'm going to teach you a home exercise, okay? Okay. bring this and put this underneath here. Okay. All right. Okay. So what we're going to do is I'm going to have you lift your leg up. You know, just lift it as much as you can. You don't want to get too much full extension in there, or you don't want to put too much strain on that graft, okay? But you do want to get some movement in there, because the more you can movement, the more movement you get, the quicker your deal is going to heal, okay? So I want you to lift it up. Very good. Hold it for 10 seconds. Okay, 1. And then bring it back down, okay? Now you're going to want to do this 10 times, then take a little rest, then do it 10 times more, and then you'll want to do the 2 sets of 10 3 to 5 times a day. Okay? Just when you're sitting around, got nothing to do, pop these out, okay? Because you really want to start to work on getting this muscle, some strength back in this muscle, in your quadricep muscles. Because a lot of times when you have this bone graft, that's one of the problems, is getting strength back in that muscle. A lot of people never get full use of that muscle again, actually. But it's getting better and better with some of the techniques that they're using to do these bone grafts now. So you should be able to get a good recovery. Okay? And remember, it's mainly about the contraction and trying to strengthen this muscle more than the movement. I mean, you want to get some, but it's more about the contraction of the muscle. Okay? Like I said, you want to avoid too much strain there. Okay? Then the next thing I want to talk to you about is more of an education type thing. Because you're now progressing to weight bearing is tolerated, and you've been doing like 50%, which you've got a good handle of what 50% is, but you really want to start to see, you know, how much weight your leg can take, you know, how much weight bearing. You really want to start to get more weight bearing on that leg. So one of the things you can do is in a set of stairs where you've got handrails on either side where you can balance yourself. You want to put your foot up on the step and just kind of rock up onto that leg and try to put as much weight as you possibly can. You don't want to not use that leg and guard it, because the less you use it, the less use you're going to have of it. And the ultimate goal is to get you back to playing basketball. Okay? And the prognosis for this type of patient is very, very good, especially with having someone who is 19 years old, who's very, very active. There's no reason why they cannot go back to playing intercollegiate basketball again. So that is my initial treatment plan. Thank you.